need to validate and verify to make sure that a system being developed yields the right products and meets functional requirements. In other words, all you need to know is that validation means that the right product was built. On the other hand, verification means that the product was built right. There are 4 types of validation. There is concept, technology, business model, and usability. The first type of validation is concept. Make sure that people understand your idea. Make sure that they think that this will actually work in their context. And make sure that they believe this will actually be successful. We'll use Mashavu, Networked Health Systems, as our example for validating a venture. Mashavu is a telemedicine system that enables medical professionals to connect with patients in rural communities. The Mashavu team noticed a need for a healthcare system beyond what the current system could provide. After further research, they found that in East Africa, there was only one doctor for every 50,000 people. Access to care is limited when people must travel long distances and spend several days waiting for basic medical care. Furthermore, out of all of the medical devices donated to healthcare facilities in East Africa, there are only a few that can actually be used. This information demonstrates a need for better access to healthcare, and the Mashavu team validated their concept when doing this research. The next type of validation is technology. Is the technology doable in your context? Is there enabling technology or infrastructure available? Do you have the technical know-how to develop the idea? And you have to make sure that the technology is appropriate. Mashavu validated their system by examining the availability of the necessary technologies in their target market. Computers, cell phones, GPS, and reliable electricity were some of the enabling technologies that Mashavu needed, and they had to have enough capacity to support the system at a price where the business model was sustainable. The research team visited shops and homes in the target area. They verified that cell phones were nearly universal and cell networks offered widespread coverage, and that the technicians were available to repair equipment and resolve technical issues. The next type of validation is business model. Does it solve a real burning problem? Do people really care about your idea? Can you bring your idea to market? Also ask questions like, how much will people pay for your product or service? Is the business economically sustainable? And what is your competitive advantage versus other ventures? Mashavu validated their business plan by examining startup costs for establishing the system and recurring costs to keep the system running. They researched the cost of equipment, data plans, electricity, and maintenance to ensure they had accurate estimates to use in their calculations. They also researched their target customers' ability to afford the healthcare services and whether they had easy access to the capital to pay when service is delivered. They compared cost estimates and revenue estimates in order to validate that the business model could be sustainable. The fourth type of validation is usability. The user experience is the complete series of interactions that an individual will encounter while using a system. Designers must think about how each step of the process can be enhanced to ensure maximum enjoyment, respect, safety, and satisfaction. One example of user experience is that a stethoscope would exhibit a live graph indicating breathing or heartbeat in real time. Meanwhile, the practitioner can record useful filtered stethoscope sounds and then play the sound back on the speaker for the patient to hear. This engages the users and provides them with immediate feedback relevant to the status of their own health. The Mashavu team needed to determine that their proposed system would be usable by the target population. First, the team examined the existing healthcare systems to learn what healthcare providers and patients were accustomed to using and experiencing. One team member posed as a sick patient in order to experience the entire healthcare delivery process. The team also met with caregivers who had never before used computers or biomedical devices. They found that the caregivers could easily navigate and operate the Mashavu kiosk. Within a matter of minutes, they learned to use the biomedical devices and the computer interface, and they became quite comfortable with operating the system and training others to do the same. As you can see, there is a lot of detail that goes into creating and validating a venture. Each aspect of the venture must be validated and verified in order to help get the venture to its goal point.